Rogers TV. This program is brought to you by Rogers Xfinity, connecting you to more of what you love. Visit Rogers.com for more details.
Welcome to Easy Eats. My name is Chef Yves Dechaine, and today we're in the Brookside Sobeys community room with Connor Gray from Lung NB. Welcome, Connor. Thanks for being on today.
Oh, thanks for having me.
So today we're going to share a simple recipe, root vegetables. We're just going to do a sweet potato chip, something different, something fun. But before we get going on that, tell us a little bit about NB Lung.
NB Lung, we've been a charity since 1933, so
Wow.
we're super long-standing, started in the tuberculosis crisis. But we've stuck around, to address the evolving threats to lung health. 1 in 5 New Brunswickers have a lung health condition. So we're here to kind of fill in the gaps where people aren't necessarily getting the services that they need. Some equipment's really expensive, like oxygen concentrators, and even smaller equipments like spacers for asthma inhalers. A lot of people just can't access these things, so we're trying to bridge the gap. So yeah, that's kind of a little bit about what we do, and we have a respiratory therapist on staff, so when people have questions, they can come on down to us.
You offer financial aid to people?
Yeah. We offer financial aid directly to lung transplant patients.
Okay.
If you need a lung transplant, you can't do it in the province, so a lot of costs come up, including not just having to stay out of province, but you have to stay there for sometimes months. You have to have somebody to take care of you because you can't really do any of the things. So unless you have someone who's able to stay at home, you have to pay for an at-home care nurse. So a lot of these costs really do add up. So we try to support there as much as we can.
So 1 in 5 people in New Brunswick, that surprises me. What other than, the obvious kind of the COPD, what other lung conditions would New Brunswickers live with?
Yeah, I mean, COPD itself does go chronically underdiagnosed, especially when people are over 65. It's about 1 in 5 have COPD specifically. But there are lots of different lung conditions that people deal with, often underdiagnosed sleep apnea, asthma, of course, and a lot of things that just kind of go to the back of people's minds. They think it's just conditional, but like a change in the weather or the air quality goes up to a 2 or a 3 and they're not sure why they're breathing a little heavier. So we just kind of try to bring awareness to all these different things, and people can come get advice on what their next steps should be, spirometry tests or different things like that to kind of check in on their lung function and just make sure they're doing well.
So you guys offer that. You guys can we can go into the office and ask for these services right there?
You can talk to our nurse.
Okay.
We have a respiratory therapist on staff, and she's also a respiratory educator. So she teaches other respiratory health nurses and therapists. You can come in and kind of get at least the direction of where you can find the thing that'll help you the most. Yeah.
Absolutely. So we're talking about lung function. So what can we do ourselves to kind of, not just personally, but I know that lung function is also environmental as well. You were saying air quality and things like that. How can we as New Brunswickers or Frederictonians kind of help control the air quality?
Yeah, I mean, air quality is a big thing. Like environmental health really ties to our personal health. So we're really lucky in New Brunswick that we have pretty good air quality, where when you're in bigger cities or when there are events like wildfires, that really changes the condition of the air, and especially when somebody has asthma. The government might not put out like an air quality warning until that level is up to like a 7, but it could affect somebody's breathing with asthma when the air quality is as low as a 3. And that could just impact how you plan your day. So if you're going to go for a walk, even just outside, you might have to wear a mask and kind of just augment your plans a little bit that day. Maybe we're working out inside today instead of outside. We are really lucky in New Brunswick to have a pretty good clean air.
So you had mentioned levels, the 1, the 2, the air quality. How is that measured? Can you explain us a little bit about that?
Yeah. So the air quality health index, it's on a scale from 0 to 100, and or you can call it 1 to 10 or 0 to 10. When it's at a 0, it means we have like perfectly clean air. But we do have these air quality monitors that we have scattered around the province. And there's a live map that you can go to our website and find a live map of the air quality, not just in New Brunswick, but across Canada. And yeah, the air quality index is available on your weather apps, on the Government of Canada's weather apps, but it is more prevalent and people are talking about it a lot more. We always talk about the UV index, but time to think about our lungs too and look at that air quality index and kind of think about our neighbors and how it's impacting them.
Well, no, you're right, because the wildfires that we had out west or in the States last year, definitely you could see the sky outside, the blockage of the sun at a certain point, which was kind of crazy. So that definitely affects the air quality as well, doesn't it?
Yeah, and people living with any of these lung conditions, it really impacts them a lot. So that's what we're just trying to raise the awareness and bring in the support.
So you must have been busy 4 years ago when the pandemic hit, and you must have had a lot of questions your way. What was your role, and how did you guys, or what kind of impact did you guys have during that?
Well, NB Lung, we were really glad to be able to provide test kits to people who couldn't afford them. I know there was a period of time that people could get them for free, and then I think now especially people have to buy them, and I think they're maybe $20 at the pharmacies. But we were able to get a surplus of test kits and masks, and we were able to distribute those and provide them to, especially for the more vulnerable, and able to supply a lot of those to people across New Brunswick. So that's been really good.
Right on. And I mean, COVID isn't gone. I mean, the pandemic is over, so it must be something that you guys are continuing doing. And,
we were previously getting our test kits from a federal surplus. So that's kind of dried out, but we are able to get masks, and we're distributing respiratory masks just for people. Anyone can come and grab one from our office. We're continuing to just order supplies wherever we can and to help distribute those.
So COVID, for people who do have diminished lung capacity or who have problems breathing, how much more did that affect them?
Yeah, it definitely affected people who have pre-existing lung health conditions quite greatly. Like for someone who's healthy, maybe they might have passed through COVID no problem. But if you had a pre-existing lung condition, that could be really detrimental. Just wearing masks and protecting our neighbors as much as we can is really important.
Right on. Did you find that you were thrown more into the spotlight during the pandemic than any other time?
Yeah. I mean, especially when people aren't getting the supports that they need, like masks available, and test kits available to even know that they have or don't have COVID. It was really important that we were able to provide those services so that people could stay aware and stay safe.
All kinds of interesting information from NB Lung and Connor. So we'll be back after these few messages to make sweet potato chips.
I'm not special. Cancer happens to people all the time. I take 1 mile at a time, 26 miles a day. I want to set an example that'll never be forgotten. Sometimes it feels endless. But the pain I feel is nothing. I've seen little kids in so much pain. Somewhere, the hurting must stop.
Terry Fox ran more than halfway across Canada to raise money for cancer research. Every year, millions of people around the world continue the marathon of hope in his name.
Welcome back to Easy Eats. Again, we are in the Brooksides Community Room here with Connor Gray from NB Lung, and we are about to make some sweet potato fries. So, Connor, I thought we'd make something simple, something easy, and something that uses up the winter vegetables. It's going to be spring soon, so I'm trying to empty out my pantry to get stuff ready. So,
Perfect.
Sweet potatoes is something that you'll find at the bottom of your pantry, and I thought it'd be kind of apt today for the episode.
Awesome.
So the first thing we're going to do is we're just going to grab a sweet potato. I've got it all washed, and then I'm just going to peel it. For these, I suggest peeling them. Usually I don't peel the sweet potato because all the vitamins and stuff, you can find a lot more in the skin. Okay. But because we're turning them into fries, it's just that texture. The peeling will just feel off on those fries. So first thing we'll do is we'll just peel them up right like that. And then once we're done peeling, I'm just going to slice it on a mandolin. If you don't have a mandolin or you don't know what a mandolin is just something that just really slices things super, super thin. It's great to have in your pantry or anything like that. There we go. I also like using the peeling. So if I don't mind the peelings, a lot of people don't. So what I'll do is I'll do the same thing. Is instead of slicing them thin, I'll keep the peelings and I'll make chips that way too. Mm-hmm. So it's kind of a waste not.
Nice.
And then here we go. We will just start slicing them here. And I'm going to slice them as thin as I can. So I'm slicing them at a 1/16 of an inch. Mm. Again, the thinner you slice them, the quicker that they'll crisp up in the...
Good consistent slices with the mandolin instead of using the
Well,
knife.
absolutely, and I mean, and it helps with your knife skills, you're right, it keeps them nice and consistent.
So why are we doing sweet potatoes?
Why are we making sweet potatoes? Well, I thought, seeing that we were talking with Lung MB today, and that I find, and lately I've been reading a lot about food, and food isn't just to feed, but food kind of heals. Food is medicine. Mm-hmm. So I did a deep dive on foods that could help lung function, and sweet potato happened to be one of them that kind of popped up because of its high levels of vitamin C, high levels of vitamin A. It kind of helps blood flow, and blood flow helps lungs. So I kind of played in that. I'm not saying that if you eat sweet potatoes that you're going to be able to breathe easy, but it's kind of one of those things that it helps. And it's also something that we just had available. Mm-hmm. So, and I figured we just kind of choose that.
Love it.
But yeah, really, you can use anything. You can use beets. You could use parsnips, carrots, whatever you want. You can kind of make a medley with all of them together. Mm-hmm. So we're just going to add these to the bowl, right like that. And then I'm just going to toss them up with a few herbs. So.
What seasonings are we using?
So we're going to use some garlic powder right here. We're going to go with a little bit of pepper. Use a little bit of thyme. And then, like I said, we were looking at talking with you guys here at NB Lung. So I was thinking of herbs and spices that help lung function, help blood flow, are anti-inflammatory. So they decrease inflammation, which allows more air into your lungs and increasing blood flow. So something that's kind of a little bit healthier. Well, not healthier really, but just kind of helps along. Mm-hmm. It doesn't hurt, but it helps. So cinnamon does that. Cinnamon has a nice anti-inflammatory. It also tastes nice, and it lends well with the sweet potato profile. Mm-hmm. A little bit of paprika to have that smokiness, and everyone likes that kind of smoky kind of chip anyway, and a little bit of cayenne. So cayenne is kind of one of those super spices. A little goes a long way. It's great for anti-inflammatory. It helps and increases blood flow because it's spicy, and it brings blood to the surface. So it kind of helps open up pores, and so it'll kind of open up those vessels and maybe not help, but have that blood drive through so you can be able to breathe a little bit easier. Mm-hmm. And then always a good glug of olive oil as well, just like that. Probably about And then all we're going to do, just going to toss these up together like that. Then we're going to grab a baking sheet with some parchment paper, and we're going to set our oven at about 425 degrees Fahrenheit. And all we're going to do is just line them up. Try not to overlap. If you overlap, what happens is the chips don't crisp up and they stay soggy. So if you wanted to, if you had a baking grate, you could put the baking grate, that way there'd be airflow that would get on through both sides. But a lot of people don't have a cooling rack or a baking grate. So parchment paper works just as well. You just have to kind of babysit them a little bit more in the oven.
I'm Craig Eagles. I have the honor to showcase New Brunswick's finest athletes and builders on Sports Inclusive. We take a look at their personal journey and how sports has impacted their lives. Sports Inclusive, only on Rogers TV.
Are you a passionate content creator ready to expand your audience reach? Do you have unique stories, captivating hobbies, or special interests that deserve a spotlight? Rogers TV is here to amplify your voice within the community. We offer you the platform to broadcast your content to a wider audience. And the best part, it's completely free. Don't miss this opportunity to share your vision and engage with viewers. Find out how Rogers TV can transform your content journey today.
This ain't no half-baked TV channel. It's Food Network. This is the place where real flavor lives.
You are the Beyonce of Food Network.
We got knockout dishes, culinary competition. You win, you're in. And epic rivalries with the world's best chefs. Grab your forks, knives, and stretchy pans, because we're serving up the best bites on TV. It's the sizzle, the taste, and the flavor. There's nothing else like it.
Hi, I'm Bob Lennon, host of the Northern Heat Report. Join me for these inspiring stories of people who have helped make New Brunswick such an amazing place to live, visit, and experience. Don't miss our next episode of the Northern Heat Report right here on Rogers TV.
So we talked a lot about outdoor qualities with the index and stuff like that, air quality index. What about inside your home? What side about inside businesses? Can we touch a little bit about that?
Yeah. Air quality indoors is definitely an important topic. Especially with house upgrades and house improvements, homes are becoming more airtight, so pollutants can really get trapped. One thing that we've done a lot of work on at NB Lung is about radon gas. So radon gas is it's a precursor to cancer. We've been doing a lot of advocacy about radon gas, especially with the New Brunswick government, because we have really high levels in New Brunswick. So recently, actually a big win that we've had just in the fall was that the government promised to provide free radon testing for houses in New Brunswick. We don't quite know what the mechanism for that is going to look like yet, but it's another step closer to making sure that we all have clean air to breathe and to prevent lung cancer and those costs that really add up down the road when people get lung cancer, and then all the medical costs that are then ensued on our healthcare system. It's just another thing we can do to make people's lives better and prevent disease in our community.
Well, absolutely, preventative measures. I know when I bought my house, that's exactly what, and I wish it would have been free then, because it was fairly expensive, but I mean, not as expensive as, like you were saying, what if we do get cancer because of it? So it was kind of a preventive measure. Yeah. We were getting it done, and good to say that there's no radon or high levels of radon in the house. Yeah. There can't be a zero, because you were saying in New Brunswick, there's higher levels than other provinces.
It comes right from the dirt, it's uranium rock exposed to the air, so it's inevitable that it'll show up, but we just want to make sure that we can clear it out of the house. And a test really, it seems like it could be a lot, but it's just about $60, and you get the test. You test it in your home for about 3 months. You send it off to the lab. We use a local lab instead of a lab in America or anything like that. We have a lab in Fredericton that does the radon test and then provides you with your results. And if you have levels, the permissible levels or like the standard declared still healthy is up to 200. Anything above that is too high, and then we want to look into how we can mitigate those levels of radon gas in your home.
And you said those tests are available at NB Lung?
Yeah, they're available on our website at nblung.ca, or you can come right into our office and we can provide you one there.
Oh, fantastic.
Yeah.
So these are ready. Well, not ready. They're ready to go into the oven. So I've laid the chips out nice and flat, and all we're going to do now is we're just going to slide them into an oven at, like I said, 400 degrees Fahrenheit, just like this. So we'll let these bake, and we'll be back after these short messages.
I'm not special. Cancer happens to people all the time. I take 1 mile at a time, 26 miles a day. I want to set an example that'll never be forgotten. Sometimes, it feels endless. But the pain I feel is nothing. I've seen little kids in so much pain. Somewhere, the hurting must stop.
Terry Fox ran more than halfway across Canada to raise money for cancer research. Every year, millions of people around the world continue the marathon of hope in his name.
Welcome back to Easy Eats. Again, we're here with Connor Gray from NB Lung, and our chips are out of the oven. They're still a little bit warm. So before we dive in and taste them, tell me a little bit more about Clean Air Day.
Yeah, Clean Air Day, it's a national initiative. There's an Enviro Week, that's kind of the first week of June, where we're celebrating all things environmental health. And right in the middle of it, on Wednesday, is Clean Air Day. So every year we do a little bit of advocating for clean air, just as we always do. Our slogan is clean air everywhere. So yeah, we have talked to different groups, different cities, and trying to get people involved. And so we have a thing called the Walking School Bus, where schools can kind of get on board and walk with their groups of kids. We've advocated with cities like Moncton in the past and Fredericton in the past, where they've provided free transit on Clean Air Day, so everyone can use the public transit system. Transportation is like the #1 polluter for air quality and air pollution.
Well, absolutely. Everyone commuting in and out of work, with all those engines and cars running.
So anything that we can do to advocate for healthy transportation, whether people are biking, choosing active transportation, walking, or taking something like public transit where we're all sharing a bus instead of taking our single-user operated cars. It all promotes lung health and environmental health, and those two things are really tied together.
So NB Lung, how do you feel that you support more? Is it more on the environmental side or more on the health side?
Yeah, I mean, a lot of the work that we do is advocacy. So we're going to advocate for better environmental regulations, because those include things like indoor air quality, outdoor air quality, and we only have things written in policy about like workplace health. So that doesn't necessarily encompass kids at schools or things like that. So we do a lot of advocacy for the environment, but where our direct help is always putting lung transplant patients first, people with lung conditions that come to us with their specific lung health concerns. Those are always where our donor dollars are going and where our funds are going to support. Everything else, like the environmental advocacy and things like this, we're always looking for grants and things. So whenever anyone donates, like their money is going to support someone who needs a lung transplant, someone who is dealing with one of those lung health conditions and needs help with breathing immediately. You can go maybe a day without food, but you can't go minutes without air.
Yeah, absolutely.
Yeah.
So if you want to help, is there any volunteer avenues that you can kind of do with NB Lung?
Yeah. We definitely accept volunteers. We've had a few people come just to provide their help even at our front desk. We're a really small team. So we always accept volunteers helping with different events that we throw on. And if you're unable to volunteer, even just spreading the word is really helpful. So yeah, we appreciate all volunteers or any help that anyone's able to provide.
Right on. No, thank you. So chips are ready. I think they're cool enough now. So grab one and let me know what you think. Nice, they're sweet.
Yeah, delicious. I love them. I like the hit of cayenne. That was really good.
Well, that's it. Yeah, and it kind of, like I said, it hits your lungs, it opens up your airways, and that's kind of what cayenne does, right? So right on, tell us a little bit more about where we can get this test kit and how this testing gets done.
Yeah. So the radon test kit's just like a little puck. You just keep it right on counter level, mid-level of your most used space in your home. Radon gas is a pretty heavy gas, so it usually is in the basements, but if you never use your basement, then it's probably best to put it where you spend most of your time. Those tests can be purchased right from our website, nblung.ca, or you can come into our office. And yeah, those tests, they're long-term tests and they're CNRPP certified. But yeah, so the radon tests, they're like nationally certified and they're tested and processed at the lab locally. So yeah, the best place to get them is from our charity. Every radon sale, a little bit of that money goes to support our other lung health initiatives.
Okay.
So, you might find a couple of dollars off if you get one at a retail store. Sometimes those tests are being sent off to labs that are in America, or they might be a little bit cheaper. But the tests from NB Lung, all the money stays locally. It goes to support other lung health initiatives, and the testing and lab testing is done right in the province.
So you just grab it from you guys, bring it back to you, and you guys send it off, or is there the information in the package?
It's all mailed directly to you, and you mail it directly back. It comes with a prepaid envelope, and the process is really seamless.
Perfect.
Yeah.
Thank you so much for being on today, Connor, and telling us more about NB Lung, one of these nonprofit organizations that we don't know enough about. So thanks. Thank you so much for sharing that with everyone today.
Oh yeah, thanks for having us. Yeah, we really appreciate it.
Right on. Thank you.
Connect with us by visiting our website or email us at comments@rogerstv.com.
My name is Chase Nicholas. I am a Mi'kmaq hockey player. Growing up, I always remember my family talking about the Mi'kmaq as the creators of the game of hockey. In grade 7, I did research on Mi'kmaq hockey sticks as the first sticks of the NHL. I found a Mi'kmaq hockey stick made in 1917, the same year the NHL was formed. I was surprised to find out the very stick I was holding was made by my great-great-grandfather, Alexander Cope. In 1934, an elder known as Old Joe Cope wrote a letter to the Halifax Herald claiming the Mi'kmaq created hockey. I found out later that I am a direct descendant of Old Joe Cope. There was a time when Mi'kmaq children were torn from their families and not allowed to speak their language, losing their words and stories, but the stories are coming back to us. Stepping on the ice, I take pride knowing the roots of the game of hockey stem from my ancestors in the Mi'kmaq Nation.
This is Rogers TV.
In para hockey, the ice tilts in favor of men. But that will never stop us.
United by passion, battling for equity. We are the National Women's Para Hockey Team of Canada.
We're here.
We're hungry.
We're ready.
Ready to inspire.
Ready to leave our legacy.
Ready to be supported and make history. It's our time. Are you ready?